Okay, so what does this approval actually mean here, big picture, for our fight against the pandemic?
Well, it's another tool in the toolkit. We're seeing as we go through and look at the number of cases of COVID-19 in Canada, that this age group, this 5 to 11 age group, actually represents the highest incidence. And that's, to be expected as we have the older population becoming vaccinated. So we are seeing more cases. We know that this group does have a lower risk of severe illness, but that is not zero. So an authorization for this age group really protects them against severe COVID-19, against other effects of COVID-19 like long COVID and this other syndrome, this multi-system inflammatory disease that can be quite severe. It also will help decrease transmission. So that means fewer other people that might be vulnerable to be very ill with COVID would get exposed. And then the last part of it is that the more people we get vaccinated in Canada, the more we can interrupt that community spread and hopefully get ourselves back to a sense of normality. And last, I think we often talk about the physical impacts of COVID, but I don't think we can underestimate the fact that, kids have gone through really, and families have gone through really difficult times. Obviously, there's a lot of anxiety. There's been, missed school, missed gatherings. So this, the vaccines help add another layer of protection, and both on the physical and the mental side will really help, I think.
Yeah, hallelujah, so true. Now, I have a curious question for you about the 3-week interval. NACI recommending 8 weeks in between the first and second doses for children. Health Canada talking about 3 weeks. Can you explain that discrepancy?
Sure. So I'll start with the Health Canada part of it. The evidence that we look at as a regulator, so the people that approve the vaccines, is really looking at the clinical trials. And when we look at those clinical trials, those controlled studies, they used a 3-week interval. And that's not new. They did that Pfizer did that for the adults as well. It is, it's reasonable to use that interval. It makes the clinical trials go faster. So we would really see that 3-week as a minimum. When NACI looks at it, they're also looking at what we know about the use of COVID-19 vaccines overall, experience with other vaccines. And there's really 2 reasons why they're recommending a longer interval. One is on the immunity side, and we've seen that with the COVID-19 vaccines, you can get a higher level of immunity and immunity that lasts longer with a slightly increased interval. And then there's also some evidence that having an increased interval might decrease the risk of some of the side effects that are associated with the vaccines as well, such as the myocarditis, which is the inflammation around the heart. So that's why they recommended the 8 weeks. I think provinces and territories will then move forward with their programs. So most will likely get the second dose after 8 weeks. There may be some exceptions to get it for, in a shorter period of time.
Right. So you're saying that some provinces may choose, Dr. Sharma, to sort of move faster than 8 weeks.
Yeah, so as we said, it's been authorized for anything more than 3 weeks. But, it really is also about seeing, getting those first doses in as many children as possible and that are eligible, and that families that are willing to get vaccinated.
What about parents out there, and I'm sure there are some watching right now, who have concerns, Dr. Sharma, about vaccinating their children?
So first of all, I think it's absolutely normal and natural to have questions and concerns about anything that you give your child, whether it's a vaccine or a medication. So first of all, that's absolutely normal. So the second part of it is then, what do you need to do? You need to get adequate, accurate, reliable information to help support those decisions, and that's exactly what we're doing. So, one of the things we've seen with this pandemic is that there's also an infodemic. There's a lot of misinformation out there. So what I would say to parents is that this vaccine is authorized. We would only authorize it at Health Canada if we felt that the benefits outweighed the risks. And so they do for the use of the vaccine. But there is information that we put out, that local public health organizations put out, the provinces and territories put out. And it'd be good to make sure that they take a look at that information, as well as, talk with their healthcare professionals if they have questions, because it's important that they feel comfortable with the decisions that they're making for themselves and their families, and that they feel confident in those decisions.
Yeah, this is a great news story, and I really appreciate you taking the time, giving us your insights and your expertise as always, Dr. Sharma. Thank you.
Thank you very much. Take care.
Spriya Sharma with Health Canada.